This is linea terminalis. What is it? That is border between what and what? Between abdominal cavity and true pelvis. And in true pelvis, it is urinary bladder. This is urinary bladder and urethra. And urethra. And it is ureter. It's attached to linea terminalis, goes medially, attached to the urinary bladder, and passes through the urinary bladder and opens here and here. Ureter has knee of 30 centimeters and it has three departments. First part, that is abdominal part, that is from the beginning to terminal line. Next, it is in true pelvis, that is pars pelvina, pelvic part. And last part, inside of urinary bladder, this one. It has 2 centimeters inside of urinary bladder, that is pars intramuralis. Intramuralis. Part. 3 parts. Then it has 3 flexura. This is flexura renalis. This is flexura marginalis, in place where it's attached to linea terminalis. And last, it is flexura vesicalis. And at the same places, we have constrictions of ureter. First constriction in the beginning, second constriction in place where it's attached to terminal line, and last constriction in pars intramuralis. Some authors describes constriction the same in pelvic part. Here it is on the distance of pelvic part, the same present constriction. Why it is important to remember about these constrictions? Because in time where urinary stone from kidney passes through ureter, it can stay in each of these constriction, and it is, first of all, it is painful, and it's blocked passage of urine, that is hydronephrosis can develop in this case. Ureter has 3 codes: external code, that is adventitia, middle code, that is tunica muscularis, consists of longitudinal and circular muscles, and inner code is mucous membrane, tunica mucosa. Ureter, the same like kidney, has a retroperitoneal position. And you need to know topography of ureter. And in abdominal part, it passes behind of ascendens on the right side or descendens colon on the left side. And then it comes to true pelvis in front from common iliac arteries and veins, in front from these vessels. Then it comes into true pelvis, and in female pelvis, it passes near of free border of the ovary, at the base of broad ligament of the uterus, laterally from the neck of the uterus. In male pelvis, it passes near of ureter, near of deferent duct and seminal vesicle. Next, urinary bladder. Urinary bladder consists of apex vesica, body, corpus vesica, fundus, and cervix. And cervix of urinary bladder continues into urethra. Here it is, we can see internal opening of urethra, ostium urethra internum. And on the fundus of bladder, we have triangle, trigonum vesica. This triangle have not got folds. Inside of this triangle, folds of mucous membrane are absent All another urinary bladder has a lot of folds. And at the base of triangle, we can see openings of right and left ureters. And between them, we have interureteric fold, plica interureterica. And behind of this fold, we have retroureteric fossa. And this fossa deeper in male than in female, because below from urinary bladder in male we have prostate gland, and it fixed fundus of bladder. That is why fossa retroureterica deeper in male. Urinary bladder consists of, it has 3 coats, the same like ureter. On external surface, urinary bladder supplies with peritoneum. It has extraperitoneal position. If you remember, that is pubic symphysis, here it is urinary bladder, this is uterus, that is vagina, and that is rectum and canalis analis. And peritoneum from rectum goes to posterior wall of the uterus, then anterior wall, and continues to urinary bladder and goes upward to anterior abdominal wall. We can see that posterior wall of bladder and apex supplies with peritoneum, that is extraperitoneal position. And here between pubic symphysis and urinary bladder, we have fat, that is fossa prevesicalis. And here it is, we have fat tissue. From apex of urinary bladder to anterior abdominal wall start ligament, that is ligamentum umbilicale mediana. This ligament has urachus, that is urinary duct of fetus. After the birth, it's closed, replaced with connective tissue, and makes ligamentum umbilicalis mediana, median umbilical fold. And between urinary bladder and uterus, we have excavatio vesica uterina, and between rectum and urinary bladder in male, we have excavatio recto vesicalis. And muscular coat of bladder has 3 layers: external and internal longitudinal, and middle layer is circular. And these 3 layers together makes expelling urine muscle, that is musculus detrusor urine, or in some books musculus detrusor vesica. More better to answer musculus detrusor vesica. This is expelling urine muscle, which discharge urine from urinary bladder outside through urethra. Urethra, we speak today only about female urethra. It has knee of 3.5 centimeters. It opens into vestibulum vagina, that is space between labia pudenzi minora. It has 2 sphincters. One is internal, involuntary sphincter in the beginning of urethra, that is musculus sphincter urethra internum. This sphincter forms with the help of circular muscles of urinary bladder. Another sphincter in place where urethra pass through muscles of perineum. Here it is, we have deep transverse muscle of perineum, musculus transversus perinei profundus, and this muscle surrounds urethra and makes external sphincter, musculus sphincter urethra externum. This sphincter is voluntary because it consists of striated muscles. That is all. Now we try to see what is this kidney. Is it right or left?
Left.
Because ureter is behind of vessels. Anteriorly we have what? Renal vein, then renal artery, and behind of them we have ureter. That is, it is pelvis renalis, and this is ureter. And what is it? Fibrous capsule. Fibrous capsule, capsula fibrosa, fibrous capsule, then fat tissue, adipose capsule, and outside from adipose capsule we have renal fascia, yes. That is kidney. Here it is urinary bladder. Here it is urinary bladder. Here it is mucous membrane. It has folds, and in lower part here at the base of urinary bladder we have triangle where folds are absent, and here it is we can see beginning of urethra, that is ostium, urethra, internum, and then urethra continues when it's attached to external opening. Here it is right and left ureter, which opens into the urinary bladder, and here it is ostium here, left and right should be here ostium ureterus, and this small part that is triangle, trigonum vesica, should be here apex, body, fundus, and cervix, neck of the urinary bladder, which continues into urethra. This is male urinary bladder. Male urinary bladder. We also can see triangle, trigonum vesica here, that is ostium urethra internum here. This is ureter, right ureter, and should be here opening ostium ureterus on the right side, and the same, this is left ureter, and should be here ostium opening of the left ureter. And between these two openings we can see here, this is interureteric fold, plica interureterica, and behind of this fold fossa retroureterica. That is prostate gland. Here it is deferent duct, that is male, internal male genital organs. Today not so important because we will study it next time. Today only urinary bladder and female urethra. Cortex, medulla, and medulla has pyramids, and pyramids insert into lesser calyces, lesser into greater, and greater into pelvis renalis. Not so clear to see because a lot of fat here. That is fat near of kidney. Clear it is. That is fat tissue. That is fibrous capsule, adipose capsule, and then fascia renalis. Your questions?